Welcome to Mental Health Awareness. I'm Dr. Ann Coretti, Director of Student Services for Nauset Public Schools, and my guest today is Dr. Kristen Davies. She's the Regional Director for Child and Family Services here on Cape Cod. Welcome.
Thank you. Thank you for having me.
And today we're going to talk about connecting with a therapist. And hopefully we'll be able to answer some questions that maybe some people may have. So let me first start off with pretend I'm a client. I'm someone looking for some help, and I call you up. Not you personally, but child and family.
Personally.
You never know. And I call and I say, I'm looking for a therapist, and maybe you can walk me through the process of what happens on that phone call.
Sure. So a couple of different things. We start off more on the business end of what it is you're looking for, because we have several different programs. So we want to make sure that we match you with the program that's going to best suit what your needs are. So it might be, anywhere from a minute to a 5-minute conversation, just finding out what's going on with you. If it's a child, finding out what's going on with them, at home, school, community, that kind of thing. Then we need to find out what kind of insurance somebody has and where they live, because the majority of the clients that we work with are in their homes, and that's from Provincetown to Falmouth up to the Bridges. So that's a really important thing to know if we're going to see someone in the home, what town they live in, so that we can make sure that we have availability at that time for that spot. But those are the main points. I think what ends up happening a couple of times is someone's going to be talking to an intake person. And the great thing about the folks that cover the phones for us is that if they feel that someone needs a little more expertise in terms of figuring out what their needs are, then they'll pass that phone call on to a supervisor or director. So
it could be you.
It could be me, oftentimes. And that's a really important thing as far as what our commitment level is to making sure that folks feel comfortable about accessing services. Because for a lot of folks, it's not a normal day to pick up a phone to ask for help. And we really want to make sure that that is a supportive experience.
Well, that's excellent.
Yeah.
That's really great. Taking that time is so important, because you could lose that person right there and then.
It is. And when you call, you get a real person. There's no phone tree.
Oh, thank goodness. No press 1, press 3, press 4.
No, and in these days, that's huge. That's huge. And when I was doing direct care, the amount of times that I would sit with families or clients who are in crisis, and it's great to have a list of numbers to call, but if you don't get somebody to connect with to say, help, I need help now, that's a huge thing. So that's why we're really proud of the fact that when you call, you get a real person.
So you have a variety of programs?
Yes. The largest program that we have is our mental health clinic. And again, we have close to a staff of 25 to 30 clinicians, fluctuating between full-time and part-time. And we have a very robust internship program, because I think it's very important to give back, because we've all been in that place that we've had mentors or folks to teach us.
So you have a partnership with one of the colleges, or a couple?
Couple, yeah. Our internship coordinator, Sue Landers, who has just taken this program and exceeded all expectations. We have 7 interns this year alone.
That's great.
And we have a really strong curriculum that is incorporated with their time with us. So it's a tough entry to come into, but if you're chosen to be an intern, it's an excellent opportunity. But back to the clinic, we have, like I said, 25 to 30 staff, and those folks are, again, going from Provincetown to Falmouth, up to the bridges and sometimes over the bridges to deliver individual therapy, couples therapy, family therapy, whatever is needed. Within that pool of clinicians, we have folks who have specialties. So we have a few clinicians who have extensive training in child sexual abuse trauma therapy. So when someone calls, we're always trying to keep that in mind too as far as a good fit, and I know we'll talk about that a little bit later. But the clinic, and we have child psychiatry. We're in the process of hopefully hiring soon an adult psychiatrist. We're very proud of the fact that we are the first provider on the Cape to move into telepsychiatry. I don't know if you've heard of this, but on the Cape, it's so difficult to provide psychiatry hours, and especially for children. And everyone is so busy. So we actually contracted out with Beacon Health Services to provide telepsychiatry. So we have a psychiatrist in our New Bedford clinic. And so every Thursday, our clients are in Hyannis, and they're doing their sessions with a psychiatrist who's in New Bedford. So to be able to increase that access to care, and that's the wave of the future, as you probably know. I don't think we can go into a medical appointment without being told, oh, we have an expert, but you'll have to go on telehealth program to access. So clinic, psychiatry. We also have two other programs that are solely Mass Health funded. One is called In-Home Therapy, and that is a two-person team, a master's level and bachelor's level person who goes in to work with a child ages 4 to 21. But as we all know who work with children, you can't just work with a child in isolation. It's the system that surrounds them, the family, the schools, the community, to really effectively promote change for the better. So that program is for someone who has a little higher acuity or need. So someone who, I think the easiest way to put it, who's having an interruption in their quality of life in any of those areas, might be as significant as out-of-home placements, or someone who might have been going along well, had a loss in the family, or they themselves had started to experience symptoms of anxiety, depression, anything that's causing that child to have an interruption in quality of life. I think that's the easiest way to put it. In addition, that program has a sister program called Therapeutic Mentoring, and that's a one-on-one bachelor's level person who's trained in mental health to work with a child to do skill development, if you will. So let me give you an example. I was working with a young woman who had pretty severe anxiety, and if there hadn't been any intervention, she probably would have been housebound. Her anxiety was based around crowds, even talking on the phone. She just was really stuck in a place that she didn't want to be. So as her therapist, we would meet once a week for that allotted time, an hour, and I could explore as much as I could within the confines of that time. But what I was able to do was to get a therapeutic mentor in place so that we worked as a cohesive team to say, okay, now we know that crowds are the biggest trigger. So what we're going to do for this week is let's try 5 minutes, just 5 minutes. So the therapeutic mentor could put application to what we had been talking about. So the TM for short took my client, and the first week they just drove and sat in the parking lot at the mall and then left. And incrementally the exposure lessened her trigger response, and she did make it into the mall. I can't believe I had to.
That's great.
Yeah. And then the phone situation she couldn't apply for jobs because of the phone. So again, that exposure therapy and real-time application was and continues to be for everyone who gets to access that service. But again, that's a Mass Health contracted program. And I think I covered them all.
And the ages for that?
That again, 4 to 21.
221.
Yeah. Yep.
I wanted to go back to what you said about teletherapy.
Sure.
By that, does that mean like Skyping, or is that phone therapy?
No, it's psychiatry. So it's a medical appointment for medication management. It's not individual therapy via Skype.
Okay. I didn't understand the tele
Yeah, well, in the
piece.
insurance world, it's called telehealth.
Okay.
And now in the mental health field, where insurances are starting to reimburse, Mass Health products reimburse for that service delivery. Private insurance is not so much, but they're moving in that direction because of the fact that psychiatry it's probably just a word of advice for anyone who's in school: go to med school and become a psychiatrist, and you will have job security. Because there are just not enough psychiatrists. And then on top of that, people who are passionate about working with children, because that's a whole nother area for somebody with medication management. So, yeah. So
Okay.
it's Skype-esque, but it's not Skype. We have all this fancy equipment so that you feel as if you're in the same room with the doctor.
Okay. Well, okay. That's great. So let's talk about the relationship between the client and the therapist.
Sure.
What that's like.
Sure.
How do you know when there's a good fit?
Well, I'm glad you asked that question, because a lot of times people think that therapy is one size fits all equation. And I really encourage anyone who's in therapy or is thinking about reaching out to receive therapy is that you're in control of this process. Meaning, if you meet with somebody and you're not feeling it clicks, that happens. It happens in life. We don't click with everyone, but this is really important because this is your best interest in mind. So, for instance, if I was the client and you were the therapist, I would or vice versa. I'm the therapist because I am one, and you can be the client.
Okay.
But I always encourage the folks that I work with to say, if this isn't the right fit, that's okay. I'm here to support you. And if this doesn't feel right, then I've got 2 other people I can refer you to see if that's the right fit. Because when you're asking somebody to share their heart, their soul, their spirit in terms of mental health and treatment, you really need to feel like you're in a safe space and with somebody who you can trust. And so that, to me, that's the top priority for anyone who is in therapy or looking for those kind of services, to make sure that you feel some form of connection with the person who's providing service for you.
Now, there's also a difference, and you can address this since you are a therapist, where sometimes issues get raised that maybe the client doesn't want to talk about. And depending upon how that's handled in that therapeutic relationship, sometimes people will quit rather than say to their therapist, I'm not comfortable talking about that.
Right. This does happen.
It does happen. Sure, it does happen.
But I would also say that as somebody who's trained to work with people and to really meet them where they're at,
Yeah.
we should have some indication about when we're starting to go into that space and place where people might be resistant. I've had clients who it's taken 2 years to get to the point of being able to go maybe where I thought we should go. But at the end of the day, it's about where that client wants to go. And there can be gentle nudges, but really this is their journey and their time frame of how and when they want to progress through whatever it is that they want to work through.
So it sounds like the process is very respectful.
Very respectful and honoring somebody where they're at, because one of the things I've always said to the folks who I've worked with is the reality of it is that 3 o'clock on Tuesday every week, you're going to be able to say, turn it on and off to say, oh yes, this is, blah, you know, is sometimes an unrealistic expectation. And I think as therapists, we know that everyone's life has this ebb and flow day to day, week to week, year to year. And so I think for the most part, therapists are very respectful of where their client is at the time of their meeting.
So clients could be seen in the home and at the agency, right? And you're located in Howardsport?
We have an office in Howardsport and also on Route 132 in Hyannis. And just to speak to that for a second, what I have known in my career, I've done mostly outreach, meaning in the homes or schools or the communities. And I think when you're talking about children especially, but also adults, it's so powerful to be in their environment so that you can see the authentic interaction between family members or school and teachers, and just seeing a person in their habitat or their safe place or whatever. I think you can really gain a huge perspective of being able to see folks in the home. But we also, for people who are more comfortable coming into an office setting and it makes more sense, we have an observation room, session room at our office that has a two-way mirror. So especially for the little kids who have had sexual abuse or any type of abuse, we have a playroom, and it's great because we can have parents on the other side as the clinicians work with them for either role modeling, reference point. It's also a great thing for our interns to be able to see someone who's an expert in this field in action to learn from. Obviously, everyone agrees to that setup, but
Sure.
Yeah, in terms of home base versus office base, we offer both. I think the majority, about 80%, is seen in their homes. And that's a unique situation.
That's very unique, especially in this day and age.
Yeah, because as we were talking about earlier, I think if you were to stop and think about having a stranger come into your home, I don't even like it when someone knocks at my door trying to sell stuff. And to think about being vulnerable enough and generally in a place of need that I'm having a stranger come into my home to sit down with myself and my family to talk about the things that challenge us, that takes a lot of courage and a lot of trust, quite frankly. So we never lose sight of that. And I think also what my experience has been is that it puts people at ease, because even the word therapy is like, and especially folks who have never participated in a therapeutic relationship. Once you say therapy, especially when kids are around, it's like, And I adopted a term a while back because I'm a family systems therapist that I become the family interpreter, because it's really about having a group of people find common way of communicating and being able to get your points across without folks shutting down and going to their own separate corners.
Good points. And in terms of your clientele, I'm impressed with the services you're talking about, but in terms of your clientele, you see the elderly, right?
Yeah.
Do you have like a percentage of your clientele is 20% elderly or?
It fluctuates year to year, but I can tell you that currently, because I just had a research this, our youngest client is 2, and our most seasoned client is 85.
Oh, that's great.
Yeah, so we do the whole spectrum of lifespan.
I just don't want the elderly to feel like they're forgotten.
Absolutely not.
We do have a lot of programs for the elderly on the Cape. This Council of Aging and the communities do a fabulous job, but not, I'm in the area of children, not the
Right.
elderly, so
Right.
I wonder about that sometimes.
Well, I'll tell you, my mom, she's going to kill me, but she's 75, and my sister's a therapist as well, and she still doesn't understand why people need therapy. I think there's a generational thing there too, and so it's breaking down the barriers, but where we're intersecting with folks is grandparents raising grandchildren, because that's a very interesting dynamic, because when you think about it, this person has raised their children and now they're taking on the second generation, and it brings a really interesting dynamic, because if that grandchild needs therapy of any sorts and the grandparents haven't experienced that throughout their parenting process, it can be challenging. But I'm telling you, that number is on the rise. I was just I wanted to find out how many families of that model we were serving. And I called a clinician who does a lot of work with family systems, and I said, how many on your caseload? And over half of this one clinician's caseload was grandparents raising grandchildren.
Wow.
Yeah. Yeah.
And it's culturally different too, with all the social media.
Oh my gosh.
And so some of the grandparents are walking into situations where the kids are around the computers a lot, and they don't know how to track things.
Right. So going back to my saying that I'm a family interpreter, or anyone who works as a family systems person, it truly is being a family interpreter, because our default mode is to just rely on our experience as a child or how it was to be parented. And when you come from that place of, well, when I was your age, it was just completely different, completely different. And as parents, we set ourselves up for really that disconnect when we come from that place of when I was your age, because it was a completely different time. That's the number one thing I hear all the time. Well, when I was little Johnny's age, I would have never, blah, 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 blah. And it's like, but let's talk about when you were that age. Let's talk about the things that were different for you in terms of not having social media or the pressures or whatever the case may be.
Totally different ballgame.
Oh, yes.
But something that they can learn.
No, oh, absolutely.
To try to catch up
Absolutely.
and help their grandchild
Yeah.
or children.
My aunt, who's in her 80s, just got Facebook. And my daughter, who just went to college, she's like, oh my gosh, Aunt Jackie's posting on Facebook every day. I start to laugh because I think, you're never too old to pick up what the kids are doing these days.
Speaking of Facebook, let's talk about confidentiality.
Yes.
So if I was someone who was being seen at Child and Family Services and another relative called, could they get information?
No. So the way that confidentiality works is, again, if you were my client, when we open up services, I would have you sign paperwork around this as far as who I could share information with and what I could share information with. So on our release of information, it literally has a checkbox of who I can and what information. So let's say a parent said that they didn't want me to share information with school or whatever.
And that happens sometimes.
Yeah, it's very customized to what they want. And I've had people who have said, I don't want you talking to anyone. That's fine. That's a done deal. The only time, as I've said many a time, is reviewing the mandated reporter law as far as if I thought that somebody's safety and harm to self was in place, that I would have to report that to the proper authorities.
Under DCF.
Yes.
Right.
Yep.
I think many people are familiar with that, but if you uncover a situation
Yeah.
where a child is at risk or...
Yeah. And it's always been my practice, and I stand pretty firm on this, that I haven't ever filed unless I'm having that conversation with somebody first, for the fact that it becomes a really powerful intervention when I'm working with folks saying, hey, this is what I'm seeing, this is what my concerns are, and this is what I need to do. Where are we going to go from here? And it's always been really well received by the families because they knew. And I'm not saying that that's a one-size-fits-all for everyone, but I think it's powerful that if I'm hearing something or viewing something and I need to file, that I want to talk about that. Yeah.
Well, that's good that you tell people ahead of time when they're signing releases and information of that sort.
Yeah.
You mentioned that we have a project.
Yes.
NASID has a project with Child and Family Services.
Yes.
Maybe you could tell us a little bit
Sure.
about that.
Our Project Hope is a project that we do with high schools throughout the Cape. And the reason why this all came to being is I was in our office, and we have a really long hallway that goes back to our session rooms. And we didn't have stuff up on the wall, and it's that nonprofit kind of gray paint that's up on the wall. And I was thinking, someone who's coming in here to feel better, this is not going to help the cause to walk down this hallway. So my daughter, who was in the National Art Honor Society, I said, do you think your group has a philanthropic component to it? And she said, I don't even know what that means, but sure. So I contacted Maureen Kessler at DY to say, this is what I'm thinking. If I could get some canvases, get a canvas donated, could you work with your students around what their collective vision of hope might look like? She said, absolutely. And so from that point, I reached out in 9 high schools, and NASID being one of the first ones to say absolutely. The first year, I drove around to pick up the artwork, and honestly, Ian, my expectation, I don't have one artistic bone in my body, so I was thinking if there was a smiley face on the canvas, I'd be thrilled. This artwork is amazing, and last year it was 2 other high schools joined, so it was 11 pieces of artwork, and we have a reception at our Hyannis office so that high schools can come and support their art students. But I'll tell you, the first year that artwork went up and we created our Hallway of Hope, and these canvases are 5 feet by 3 feet. They're very large pieces of artwork. And our receptionist was out, so I was covering the phones, and I was sitting up there, and this woman who had been coming to our office for many years, struggling with depression, walked through, because the door opens, and she walked through, and I heard this gasp. And she started to look at this artwork, and tears came down her face, and she said, "I can't believe high school students would do this for someone like me."
Oh.
I know. I still get goosebumps. It was and continues to be so powerful because it's getting communities together. One of the things that was really important to me was obviously mental health awareness, but getting it into high schools in a different way. And to see these young people who want to help, who want to support, and celebrate it through what their passion is, which is art, it just really, it's unbelievable. Yeah,
Oh,
really.
That's a great story.
I know.
Oh, that's
I know,
nice. That's
I know.
great.
Yeah.
Well, our time's coming to an end,
Really?
really. But I want to thank you for coming, Dr. Kristen Davies.
Thank you.
This was very enlightening and
Great.
great. You offer great services.
Thank you.
And thank you for coming so much.
Thank you.